Emily. We are joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health.
Doctor, great to see you as always. So the governor and the state health officials say that we are in the surge, but hospitals are managing it. There seem to be fewer patients admitted than initially predicted. So give us a status update on the situation at South Shore Health, please.
Sure. I would say in our system, we're seeing a flat curve. Now, that we're still seeing a lot of patients, but fortunately, the stay-at-home guidance and what the public is doing has not only saved lives, but it's been able to keep our capacity at a place where we can take care of our patients, and it's made it so we don't have our ventilators. We still have capacity there, so that's really critical. And I just want to thank everyone for doing what they have to do.
So before I ask the next question, should we feel optimistic about that? Because we want to feel optimistic.
With no question, because I really think that as we're looking at other epidemic curves, we're seeing things flatten and then they tend to decline. Once those new cases start to decline, we know that mortality follows that. So I think that's very important.
Okay, good. So Harvard came out with this assessment that Massachusetts has to double its daily testing per capita before we can open up anything. So where are we with the level of testing right now? What do we need to do now to assess where we are ahead of this virus?
Well, I'm encouraged. What I'm hearing from the governor, what I'm hearing from the mayor is that there's more and more expanded access to testing in our neighborhoods, in our communities, and that's critical. Testing is very important, but I do want to say that equally as important is the vulnerable patients, the elderly, those that have chronic conditions, whether it's obesity or chronic heart or lung diabetes. Those patients really have to continue with the social distancing and the stay-at-home guidance. We have to protect them. They're the most likely to get real sick from this.
And Doctor, we hear about the antibody testing. So antibody testing in Los Angeles suggests that the number of COVID-19 cases there could be 55 times perhaps higher than reported. Does this change the picture of what we know about the virus and how to respond to it?
So more good news, Ed. What we're seeing, remember the tip of the iceberg when we said the confirmed cases, we know that there's many more patients that are infected. So what that means is instead of there being, 750,000 people in the United States, there's really probably more like 20 or 30 million people that have been infected. What does that mean? The mortality rate is much lower than that 4 or 5% that we're hearing about. So that's good news. But still, most of the country is still susceptible. So we have to be careful. That virus is going to want to have a second wave.
Well, we don't want that to happen for sure.
Right.
Dr. Todd Ellerin, South Shore Health, thank you so much always for your expertise. Be well, doctor.
Be well, Doc.
Thanks,
Thank you for your time.
Take care.
4:50.